Hello, I'm Holly Tanner with the Herman and Wallace Pelvic Rehab Institute, and I'm getting the chance to talk to Lauren Mansell about her course that she has created for the Institute. Lauren, when I first met you at a course, I was so impressed with your background and how that could potentially lend itself to sharing information with folks about trauma informed care. Can you tell us a little bit about your background?
Absolutely. And thank you, Holly, for having the interview today. I started in trauma work in the 1990s. I was a medical and legal advocate for sexual assault survivors in the emergency room. I was trained by an agency called Rape Victim Advocates, they're now called Resilience. And that began this journey. My major was in econ and I was going to law school, and that changed quickly. I got a degree in psychology and sociology and then did counseling for 4 years. During that time, I became a firefighter and EMT, and that's where all of this work in the autonomic nervous system came in because all the meds that we push on the ambulance are based on autonomics, and some of it didn't make sense to me. So I was already starting to question and was really wondering on our responses during stress. I ended up in PT school, kind of, in a really fascinating, wonderful, roundabout way. And physical therapy, I've just been so honored with being able to use all of that trauma work and all of the psych and social background to bring in trauma informed care.
Mhm. Well, that's a perfect segue to tell us a little bit about your course then. What course material, topics and information can folks expect to learn with your course?
Yes, the trauma informed care has had a bunch of different ways that we've pushed it through. It's been live, it's been segmented into empowering sexual assault survivors, looking more into trauma awareness for the medical provider. So we're really happy to give the current course, which is a 15 credit hour continuing ed course that has some pre recorded content and 2 days of uh, online live via Zoom coursework. So the trauma, it's so big, right? We all know what it feels like. We all know what it's like to be in situations where things just got flipped in our treatment room, and we know how we feel. We try to kind of have an idea of how the patient or the person experiencing trauma feels. And this course was really developed to go through all of the science, the neurobiology, the physiology of trauma. So there's a great understanding as to what's going on physically. And that helps our patients because we're physical therapists. So having a way to frame that traumatic experience and their response really is what's going on because they've been inadvertently triggered, possibly on our table. And being able to frame that within the autonomic nervous system, polyvagal theory by Stephen Porges. This is really, really amazing work and really has just I created this course for me really so I could understand, and then hopefully to give it forward to all of you so that you can help yourselves and help yourselves help our patients.
Oh my goodness, so many wonderful thoughts come up as you speak about these pieces. I was just talking to our colleague Jessica Rial, and she was doing some mentorship with a clinician, and the clinician said, "Well, but what do you do when someone who has experienced trauma and is presenting with, just some of those pieces in the treatment room? What do you do on your own, right? Because what do you do with yourself and your own feelings? And I think those feelings can range from deep compassion that wants to fix or wants to really attach to that person in a dysfunctional way, right? Versus you want to just never see them again because it's just so challenging and might bring up your own fears or worries, or you just simply might feel like you can't handle that load. And I know you know exactly that spectrum I'm talking about. And so I imagine your course also offers some skills in therapeutic relationship building and the necessary detachment that needs to occur, but still staying connected to the patient, which again is such a balance, isn't it?
It's so true. We go through a ton of the secondary effects of trauma, compassion fatigue, We also do spend a lot of time, and we do a lot of role playing in what happens during treatments when either where patients are putting things upon us as clinicians, or inadvertently we're kind of accidentally putting our stuff onto patients, or having a rapport relationship that is mirroring those. So that's also very, it can be icky, right? Like it can we can get really bogged down with some of this emotional context, and so it's really great to have frameworks. We go through SROCks, which is a way of uh, going through and resolving trauma experience for ourselves and also for our patients through the course, and just really having a nice framework, and any and all ways that we can create safety for ourselves and create safety for our patients.
Mhm. And don't you find that patients are very capable of integrating the knowledge and the intellectual pieces about trauma when we can present them in a way that
Hmm.
is, again, not blaming them, right? But it's just saying, research informs us that people who have had these experiences can then sometimes feel this in their body, want to control this piece. And I find patients do a really nice job being able to take that knowledge and not necessarily integrate it in that exact moment in the treatment room, but perhaps to come back the next time and say, that's really interesting that you said this. And I felt this and I noticed that. And would you share that
Hmm.
experience too? That patients, they really do benefit from the intellectual academic
Hmm.
pieces when it's integrated into the context of what they're experiencing, and still, of course, not pushing them. But also, when I say not pushing them, I also tend to see a lot of younger or newer therapists, or those who are not comfortable in that space of trauma, again, just discharging their patients or blaming their patients. And being able to sit with that discomfort is so
Absolutely.
important.
Yeah, we're shedding light on something that's very real, and it's something that patients they've experienced the blame and the shame, and they've internalized it. So it hasn't, sometimes until they've, come into our rooms and they're getting help medically for some of their dysfunction, that, no one's really framed this in a way that there are neurobiological and very physiological reactions that are happening from the trauma. And that is such a wonderful piece to give our patients, that we as physical therapists, as medical providers, we should be giving to them, because it's very real and it's very reassuring to the patients, because otherwise they feel like it's them, that it's their fault, that they're defective, that they've been made the person that's been identified as the problem. It's been the most empowering work, and it's also the most challenging work. So I'm
Mhm.
just so grateful to be able to bring some of these tips and techniques and all of this, the science behind this, the evidence, the research, all of the resources
Mhm.
for anyone who's interested in working in this.
And you say everyone, it isn't just physical therapists, right?
Mm-mm.
This course is relevant to any pelvic health providers and any person who has the license to work with these folks in the
Mhm.
capacity that we do is welcome. And wouldn't you also say that there's something just especially poignant about a lot of the shame that tends to get associated with bowel and bladder function with sexual activity, and then add in a pain piece and it just
Mhm.
gets really compounded.
It really does. And just sitting down and piecing it out can make a world of difference for our patients and for everyone, really, talking even with our coworkers, with our bosses about this work. There's been a lot of empowerment after taking trauma informed care of participants going back and creating policy and having these really big discussions. And I give permission to use my content. Please take it back to your organization. Please tell others about this important work, because it's going to be in the next wave as we become more inclusive, as we become more progressive, very interdisciplinary. We're going to see this trauma work really become important and as a very strong foundational piece for medical care.
Mhm. And what would you say to the folks who perhaps are almost afraid of taking the course because they feel that it might touch on their own trauma experiences and it might just feel too raw for them?
So this is very real. This is very, very real. 1 in 2 women and 1 in 5 men experience unwanted sexual attention or um, unwanted experiences that show up in trauma. So we have TAs. We address it right from the get go. The pre recorded content is a lot of the factual basis. So there's not as much as that experiential, but at the very beginning of our live component, we are just identifying like this is very hard stuff. And to push things down and to not give credit for what people's experiences have, that doesn't help anyone. It's also not an individual counseling, so we're very clear that these are tips and techniques to help others through medical care. So we have resources. I have TAs that can help anyone who's experiencing any kind of triggering event from the content on how to reach out and how to find the appropriate resourcing in real time. So we will do calls with anyone who's not doing well with the content. We just make a breakout room, and it's
Mhm.
completely normal. It's 100% okay. I feel like all of my work as a pelvic therapist and within working within trauma has been normalizing this, saying that this is actually quite normal, and I expect it with everyone who comes into my room. I treat every single patient, every single person as someone who's experienced trauma. It may come out on the table, it may not, but just having that awareness and having that readiness and having my tools and all of my self care and making sure that I'm in a really good place so that I can help others.
Mhm.
That's really what this work is about. So it's my job to help everyone who takes the course feel good and feel safe. Also knowing that it is not a counseling session, so we have to be very good with our boundaries and what the the course objectives are.
Mhm.
So it's 50% right from the very big get go. We're like 50% of us have experienced some kind of unwanted sexual touching. If we're going to go to the sexual abuse side, because that's
Mhm.
really where this course content tends to to look at, or that's where the participants are guided towards as tips on that. We also go through domestic violence or intimate partner violence. We go through trafficking. We go through all sorts of adverse childhood events that, I mean, research has just shown time and time again. Those people that have been traumatized have more medical comorbidities. So, we go through it all. And I would just say, just if you feel like we're never ready to do this work, right? We're never ready to be perfect, but just showing up and just having an open mind and taking what you like, leaving what you don't, and that's really what this course is all about, and really trying to empower ourselves.
Well, thank you so much for your time. We're so grateful that we have this offering because of you. And I know folks are just going to be so excited to keep learning more from you.
Thank you so much.
Thanks, Lauren.